is the advice that we're getting from medical professionals such as Dr. Fauci and so forth, how good is that? Is this something where the mainstream media is providing accurate or inaccurate information? How should we be looking at that?
I think Fauci's doing a really excellent job. Dr. Fauci's doing a really excellent job given some of his constraints. I think in general, most of the media is trying to do a really good job. But of course, if they're provided bad information or the information changes, then the story changes. And so we have to go back to the fact that we still don't understand a lot about this virus. We still don't understand really well. Is it, for example, spread through tiny droplets, through big droplets, or is it just hang in the air? And there's variable and contradictory data on that. And so if you don't understand the background, then of course the information is going to be less reliable.
So if we don't know how big this pandemic will become, right now, the last I checked was we had something like 225,000 confirmed cases and about 5,000 deaths in America this morning. What if those numbers increase by a factor of 10? What happens then, and what is the best way for us to prepare for that so that we're safe and healthy?
We're focusing right now on trying to mitigate that so that we don't see that increase. The best thing we can do right now is social distancing and really good hand washing. And then as a country, we need to be much better about figuring out a way to get adequate supplies to the hospitals. That's protective equipment, ventilators, extra beds, extra spaces. And you're seeing now that hospitals are, based upon the executive order that came out 2 days ago, are going to be expanding into what was traditionally non-hospital areas. So you're going to see patients being cared for in maybe clinics, hotels, things like that. So we need to ramp up we need to do two things. We need to ramp up our capacity so we can take care of more patients, and then we need to decrease the rate of disease increases so that those two things can match. So we have enough resources to take care of the people who are going to get sick.
So it's not really a medical question, but what I'm hearing is that this is a black swan event that's really changing not only our economy and our health, but it could change society. You're talking about things to do with international supply chains. 9/11 changed American life. How will COVID change American life?
Well, I don't know if we can predict that, or at least I can't predict that. I think fundamentally this will change American life, and I think it's going to be hard to know exactly how we're going to come out of that. But even things like, I have young children at home, distance learning. Nobody would have ever really thought that that's going to be something you can do for young kids, and now yet we're doing it. And parts of it will work, and parts of it won't work. And I'm sure that will change learning going forward. Same thing for college students. Transportation has been decimated by this because people aren't traveling. And I'm thankful they're not traveling. But at some point, we're going to need to travel, and how that's going to happen and what people's reactions to that are going to be. Your business, other businesses, how are those going to be affected, and how are they going to try to adjust to meet, what might be new demands, yet old demands are no longer there. I mean, you see that while many companies are laying people off, transportation companies, big box stores, Amazon are hiring people because that's where people are shopping now.
But Charles Darwin had a quote, something along the line that it's not the smartest or the strongest that survive. The species that survive are those that are the most adaptable to change. So this will end. What are the type of adaptations that you think are necessary right now?
In terms of the health?
Yeah, changing our behavior beyond just social distancing, which is, I guess the follow-on question there is, how long can we maintain social distancing? Because a lot of people are going nuts with their kids at home. But beyond that, what do we do?
I really think right now what we need to focus on is the social distancing and making sure that remains something that's feasible in terms of we have to be able to have food And, we have to be able to get health care, and then people have to do what they can do to keep themselves healthy and not to spread this around. Even if they have it asymptomatically, if they spread it around, they're making it worse for their community. And that's really got to be our major focus right now.
So we just got a question from Dr. David Fogel, who's an advisor to our company. How much should we be worried about what's happening in, say, we're in California, and early indications we've flattened the curve at least a little bit. When we see things happening in New York and Florida and so forth, where things are going to get bad, how much should we be worried about how much does the other states' actions impact us here?
Well, certainly there's a limited supply of resources in the entire country. And so, the more resources that are used in other places, the fewer resources there'll be wherever you may live. That said, all the communities and all the hospitals are actively working on trying to get involved with this, and we're slowly ramping up production. The industrial production, the longer that we can delay that peak in a particular area, the more likely that area will be able to manage that peak.
So we talk about the doubling period for the number of days for the disease to double. What's the doubling period for the medical infrastructure to keep up? Is that presumably it's a lot longer?
I don't know the answer to that question. And what you're seeing though is you're seeing pretty serious efforts to increase capacity. You're seeing, the 2 Navy ships, one in New York, one in Los Angeles. You're seeing field hospitals being built. You're seeing hospital systems, individual hospitals, setting up tents to take care of patients outside their hospital, setting up clinics. There's going to be movement towards ambulatory surgery centers. So pretty much all elective surgery has been canceled in the United States. So the things that ambulatory surgery centers typically do, like maybe a colonoscopy, a minor surgery, those have all stopped. And so they have a bunch of healthcare equipment. They have some healthcare personnel. And so I think you're going to see, in fact, I know you're going to see patients being taken care of in those places. So hospitals will be moving patients from inside the hospital to those type of areas, and then maybe perhaps to hotels, so that we can reserve the hospitals for the sickest of the sick patients who can't be taken care of anywhere else. So we'll find other places to take care of people who can't be safely taken care of at home and need some care, but don't necessarily need to be at the highest level of care in a hospital or an intensive care unit.
How do we maintain our discipline around staying at home, social distancing? Because back to that fatigue question, boy, my 8-year-old niece who stays with her, she's sick of it. She's like, oh, let's go play. And from an 8-year-old perspective, I get it. But from my perspective, how disciplined do I need to keep my family to keep them safe?
I think that, for children, it's very hard for them to understand this. And even for young adults, sometimes it's hard for them to see this because they've heard that they're not likely to get that sick. So knock on wood, unfortunately, very few children under the age of 20 have died from this worldwide. But children don't even understand that to begin with. I think as adults and as parents, we need to recognize that this is devastating already to many communities, not just economically, but health-wise. And, if you go look at some of the news reports and some of the videos out of, say, Italy or even New York City right now, that should strike enough concern and fear into your heart that you'll say, I'm going to do what I need to do to prevent this from happening to my community, my family,